Hey guys, this is Mandy again. Here is to another edition of While I'm in My Car. If you haven't figured out, it's obviously the easiest time for me to make videos is when I'm in my car going somewhere, and I am currently in North Carolina, actually going to work to go do hair. So that is what I'm doing today. So today is April the 12th, I think. It's the 12th. It's April 12th, yeah. So here's the deal. I went last week, and like I told you guys before, and had my CT scan done, which showed I had a very thin abdominal wall with concern for my right ovary. So on Monday, I actually had my appointment with the abdominal wall reconstruction surgeon at Walter Reed Hospital in Bethesda, Maryland. And this is kind of how it went. And yesterday, I think it hit me more than it did the actual day I talked to her. So I'm going to try to recall for you guys everything that happened, and everything that was said. So basically, first there was like a resident person that comes in and says, "Oh, you have a huge abdominal surgery history, blah, 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 yeah. All that, yeah. Okay. I've had like 7 surgeries in 10 years. Yes, that's true. Okay. So she proceeds to say, she wants to look at my belly. And I proceeded to tell her that if she was going to try to push on it, and then the doctor was going to come in here and try to push on it, I'd rather her just wait. So she said, okay, that's fair enough. So basically, I got on, the doctor came in and she said that the issues with my abdominal wall is, so you know how like if you see people that have a 6-pack and they have that line that kind of goes straight down the middle, that is called your diaticus erectus is what that muscle's called, basically, that goes straight down like the center of the 6-pack. Well, when I had my surgery last year, and then I had basically a tear at my JJ spot, they had to cut me open basically right where that muscle is. So needless to say, I've been uncomfortable with the way my stomach looks. I've been uncomfortable with the way my scar healed, and I just have never felt like it looked the same or looked right, you know what I mean? So she said that that's basically where they cut me, is where that muscle is, and over time, it's just not ever healed all the way right. And some of that has to do with it being an emergent situation when they cut me open, and then the healing process and stuff. So at the top of my incision, for about probably 6 inches of it, she said the best way she could describe it is it looks like Swiss cheese. So instead of it just being a piece of American flat cheese, it's got holes in it, which is my intestines are pushing up. They are not protruding, but they're pushing on it. So that's why the top part kind of looks the way it does. But the biggest problem is down around my belly button, which is where I have most of my discomfort. And again, I can't wear pants that have buttons or zippers. There's just a mass of intestines that are trying to push through what is left of that tissue and of that muscle and stuff. So she said that I definitely need to have surgery, and at this point it's about quality of life, because it's causing me a lot of issues as far as, other than the, what it looks like, because it really looks like I'm about 5 or 6 months pregnant, especially later in the day. When I eat, especially if I eat denser proteins, or just any type of heavier weighted food, even if I eat like eat broccoli or something like that, something that's got like some weight to it, I can literally feel, well, I've always been able to feel how I drink, but I can literally feel the food coming down where it hits the top of that point. It goes down to my, where my belly button is. It starts to burn. And then as it starts to work its way through my intestines off to the right and turn to go down, it just burns. And the only way to get that to not be just completely uncomfortable is to get up and walk around. I have even tested trying to drink a little bit when it burns, and that still doesn't help. So it's basically how my intestines are like kind of, in there, and they're trying to push through. If that's the best way I can explain it. So, she asked me, what kind of things is it affecting in your life? And I said, well, obviously I can't wear any clothes that have a cinch to it. Even yoga pants towards the end of the day bother me. It's hard bending over to put my shoes on. And, even when I was at my highest weight, like almost 260 pounds, if you're not, further along in your weight loss journey, you can remember trying to bend over and put shoes on, and how it just kind of would like cut off your air. It just burns, like to bend over and put my shoes on. So I'm looking forward to flip-flop season. But and then also, sexual encounters and stuff. Like I don't want my husband anywhere near on top of me, just because of the pressure of of him. But it's kind of like, I know what it is now. My brain is kind of trying to process, having to have another surgery, because I really, I'm so over this shit. It's not even funny how over it I am. But so it's moving on. Okay, so the surgery, she said, would be a 2 to 5 day hospital stay, and that is going to be determined by when my bowels decide to wake up. Because whenever you have surgeries like this, because here's the thing, she has to reopen me in the same incision that they did last year, which I was kind of like, oh God. But the good thing about it is she will be able to remove scar tissue. She will be able to do a scar revision. She said that my scar is going to look 1,000 times better than what it does now. She said from the CT scan, she's going to anticipate that they're going to have to remove some of the shredded tissue that's in there, and they're going to have to reinforce it with a mesh. Now, without being able to see inside my body, she said, because I've had so much weight loss from my highest to my lowest to where I am now, which is still around 188, 190. She said that according to their, I guess, calculator thing, I'm a perfect candidate for this surgery, especially with my weight loss, that until they get in there, they will not know if they have to help reinforce it more with a side muscle. So basically you have 3 side muscles on each of your sides. She said that mine looked really good, that they're, very viable if they had to take some of the muscle from one of my sides and use it to reinforce the abdominal wall because of how weak and thin it is. She said regardless of what they do, they will have to put 2 blocks, one on each side, that will last for 3 days. So I won't feel any pain or anything for 3 days. And that helps, A, with you not being on so many narcotics. B, it helps with your bowels waking up. Because if you continue to take, Oxy or, whatever drips and stuff, it makes you constipated. And with bariatric patients, that's even worse. So, with a lot of people, they just do the 3-day blocks on each side. She said if they don't have to take a side muscle to help reinforce it, that I will not have, to the best of her guessing right now, a drain. If they do, then I will come out with a drain. And that my recovery process, once I get out of the hospital, is going to be 6 weeks. So, one of the questions is this going to be like a tummy tuck? And no, it's not. This is purely for function of life. I do not have any type of rashes. My bottom fat roll is still like it still wobbles, but it's military, and they're not gonna pay for that, basically. So as far as that goes, just having to wrap my head around that process of doing another surgery has got me a little twisted up. With that being said, I do have a surgery date of July 21st. Now, the thing about that is this. With the military, you have to do it on whatever schedule they give you. My surgeon, Dr. Cox, who is a female, is actually having to cover 2 military treatment facilities because Fort Belvoir's surgical team has all been deployed. So with that being said, she's having to take over their surgical workload for any type of hernia or abdominal wall reconstructive surgeries. So that has pushed me to July 21st. The problem for me is this. My husband has to take a 10-week course that he cannot miss any days, or he will be completely dropped. This is almost smack dab in the middle of that course. And he really would like for me to push it off till he's done with it so that he can be with me from the day that I go in to the day that I come out, and then take another full week off after. Now, I had a very long talk with my therapist yesterday because I don't know if I can do that. Wait until July, it's going to be a struggle enough for me. Because especially when I eat something, like right now I'm like, oh yeah, I can wait. But as soon as I eat something and the burning starts, I'm like, I can't do this. So her and I were talking yesterday, and she's was giving me ideas of how to kind of start the conversation. And then also I do have a lot of time to kind of pre-plan, and it's not that I don't have help. It's just that my mother usually comes, but my mom's in her mid-70s. She doesn't drive my vehicle, especially up in Bethesda, Maryland, and the DC area. She's under 5 foot tall, and she can't hardly see or hear, and she drives with 2 feet. So that ain't happening. And I have quite a few volunteers that are willing to come help me as well. But I had to kind of flip that whole thing because my husband has been with me through a lot of different surgeries, and especially the last one, he got really scared. And I just keep playing over in my head him saying, I just knew that they were going to come and tell me you were dead. I just knew that when they took you in there that the chaplain was coming around the corner at 1 o'clock in the morning. I knew you didn't make it. So I'm trying to be sensitive to his desires to want to be there. But like I was telling my therapist yesterday, I feel like this is going to be a completely different surgery because unlike the last 3 surgeries or 4 or however many, they're not going in there and they're not cutting up my vital organs that I need to breathe or eat or drink. And it seems like even though it's going to be a tough recovery, as long as I get up and walk, wear binders, I'll still be able to eat and drink like a normal person pre-op and post-op. So I think I'm going to try to stick to the July 21st date and push through. So that's that. Also, something very interesting she told me is they prescribe a 24-hour diet for all of their hernia/abdominal wall reconstruction patients, which consists of carb loading, which is really interesting because I probably will have dumping syndrome that day. But she said basically it consists of eating or drinking frequent high carb, high protein shakes. And she said the reason why they do that is because it's kind of like when you go run a marathon. You know how people like carb load the day before for the energy? They want your body to kind of have that energy in it. They want your body to have that energy so that when you come out of surgery, your body can heal quicker. And she said and studies have shown that you actually get out of the hospital a half a day sooner. And she goes, a half a day sooner is better for you to get home and not be in this environment where somebody's walking in your room every 90 minutes to 3 hours to do vital checks and take blood. You know, and that kind of made sense to me. And I was like, well, sure, you know, I'll do it. I've done protein shakes for over 10 years now. It can't be that bad, right? Anyway. So, and then my referral for my right ovary ultrasound is in the system, and it's just got to be scheduled now. So, anyway, that's that. I will keep you guys updated as soon as something else happens. I'll talk to you guys later. Bye.